Channel 5 Network, this is MorningLine with Nick Beres.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Beres here on a Wednesday. You know what? We're not going to talk about the rain. Let's just pretend it's not there, because if you're indoors, you're not out in it, and you can just watch the show. The rain, to heck with it. Don't go out. Join us on MorningLine this morning. Good topic, health-related topic, something that affects us all, because guess what? All of us have hearts. I think. Most of us do anyway. We all have hearts, and heart health, vascular health, all of that. We like to do a health-related show once in a while. This one especially in keeping with this is American Heart Association, or American Heart Month. American Heart Association, of course, very involved with that. And, you know, there are doctors that specialize in this type of thing. We've got some great hospitals here in Middle Tennessee. We're going to talk about it this morning with our guest from over at Vanderbilt University Medical Center, Dr. Joshua Beckman, Director of Vascular Medicine there. It's good to see you again, sir.
So nice to be here.
I think you were on last year at this time for National Heart Month.
I think I was.
And so I think we should do this every year.
Let's book it
for
now.
This month. I mean, look, we're halfway. We're almost at the end of this month. And look, you like to say it. I believe it. Every month is Heart Month.
Every month is Heart Month, because every month your heart's beating.
I hope so anyway. It's true. Everyone has a heart.
As far as I know. I mean, even in medical school, everybody had a heart.
Everyone had a heart. Well, the idea, and we'll open up the phone lines for you, 737-7587, is kind of just to discuss the basics of heart health. So much of what you already know, but some of what's new that comes about, and what you're seeing these days. Look, we all know about cholesterol. We all know about keeping blood pressure down. Before we get into some of those and some of the new things to treat them, what is new out there with regard to heart health, or is it just advances along the same lines we've been in?
You know, I think a lot of what we're doing is continuing what we know what to do, and really making reinforced efforts at it. I think one of the best things we can do is put into perspective how well we're doing. Heart disease used to be basically the cause of death of half of people who died in the U.S. And over the last 50 years, we've brought it down. It's still the #1 cause, but it is not anywhere near where it was. The rates of death from heart disease are about half of what they were in 1960.
All right, so that's some real progress.
That's right. And you know how we've done it? Slow and steady. We've done it by people eating better, people stopping smoking, some improvements in medication, some improvements in rescuing people who unfortunately have heart attacks. I think everything working together is the way that we have had this steady progress in reducing deaths from heart disease and stroke.
Any new drugs on the horizon for one way or the other? I know we talk about statins for cholesterol, treatments. Anything on the horizon that might be new and exciting?
So there's a couple of things that have happened over the last year or so that I think will be really good for folks that already have heart disease. One of them is the use of a really low dose blood thinner, not your usual blood thinner for, say, blood clots, but a much lower dose that seems to reduce, again, heart attacks, strokes, and death. And then there was a study recently that looked at a specific kind of fish oil that seemed to have a really impressive benefit as well. I would say that in the face of all the other fish oil studies that have been fishy, that we want to wait for the confirmatory study that'll be out in the next year or so. But those two are pretty exciting, and the combination of them would have a pretty impressive effect. Good.
It's just interesting. It seems like there are new studies that come out all the time, and you'll hear one thing that something is good for you, and then it'll come out later that no, it's not. Actually, it's bad. I mean, you have to be careful to read it. I'm to the point now where I just do what you say, which is just try to eat right, you know, in terms of not super heavy fats and fried foods all the time, even though I'll splurge, and then exercise. Basically, that's it. Get some rest, right? I mean,
get some rest. Don't smoke.
Okay, that's a biggie.
That's the biggest.
What about drinking? I like the idea of getting lots of resveratrol. So should I have a bottle of wine a day?
I would say a bottle of wine is a bit much.
That would be a bit much.
You know, as a physician, I'm really careful about recommending alcohol intake.
Yes, right.
But in studies, 1, maybe 2 glasses a day are associated with lower rates of heart problems. Yeah.
You know, when I leave here today, right after this show, as you walk out, I'm going upstairs for a biometric screening. All right.
Good for you.
This is something we do. It's just going to test. We'll find out body weight, all that. Among other things, they're going to take a little bit of blood to do a blood test for cholesterol. Is there a difference in terms of testing now? And I fasted from last night, you know, what I was supposed to do, but they're going to do it with a finger prick.
Yeah.
All right. As opposed to when they take more blood, when they need to do more tests from the arm. Can they both be accurate?
Yeah.
Okay, so
both
even
good.
blood from there is going to be the same as. The idea of fasting, hopefully what I'll have then is a baseline of what I'm really like when I'm not influenced by maybe having had something to eat like bacon and eggs for breakfast.
Exactly right.
Okay.
Yeah, you don't want to see your lipids on a chicken waffle.
So, okay, but for that moment after you've had your chicken waffle, which by the way is delicious.
Spectacular.
Spectacular. You end up having a slight elevation temporarily, but that clears out then?
Well, yeah, just have to, so the way that I like to think about cholesterol is that what it's doing to you, it's doing to you over days, weeks, months, years.
Right.
And I would say most of the day, we are all in the I've just eaten phase. Right?
I think so.
So there is some value to knowing what your cholesterol does, but the way that guidelines have been set up and how we've studied it and based treatment, we want to know the fasting level. That's how we figure out whether or not medications are needed or just exercise and better diet.
And you're still a firm believer in statins?
Firm.
Really?
Firm like rock firm.
I mean, all right, see, I wanted to do everything I could to avoid a statin, and I actually brought my cholesterol down on my own through diet, fortunately, and it worked. But I know some people can't, and I believe statins work. But I worry about some of the sides that could come with it. Be it, they always have to do your liver check, which is rare. There's a problem there. Some people complain about muscle aches. Other people complain about maybe memory loss, I don't know if it's real or not. I'm not trying to scare people. Others say, look, if you keep getting all the cholesterol out of your system because it's in your veins, I mean, your body needs cholesterol. Your brain needs cholesterol, right?
Yes, so we have been unsuccessful so far at bringing cholesterol to zero. There is no way that any time you take a statin, you're getting your cholesterol to zero.
Right.
You will have no, and you'll have cholesterol left over. It's a building block for your cells. It's clearly important to have, but you don't want to have it in excess. You don't want to have it so that it then builds up in your arteries and causes plaques, which can then rupture and cause things like heart attacks. So, look, the statins, they're all generic now. They've been around for 25 years or more.
There's enough.
There is so much information, and I'll say this. I do think that some people get muscle aches, and the only really proved side effect is that it can speed up by a period of weeks the time to which you could become diabetic from not diabetic. This is everybody moving to the right a little bit, but outside of those, the truth is they have saved so many lives that we've seen many, many times that as more people take statins, fewer people have heart attacks.
Yep.
And so we will work with you to try different statins, different doses, to get rid of some of the side effects if things happen. But most of the time, and I don't want to say this in the wrong way, but as you get into the older ages, you get muscle aches whether or not you're taking a statin.
Okay, so I see what you're saying on that. And as far as statins, though, you would only recommend and prescribe them for someone who has an elevated cholesterol to the level you're saying. Would you not want to take a very low dose of statin as a preventative for someone who has no issue at all?
So it's actually, I'm really glad you asked that. So that we have a variety of ways of figuring out whether or not it's worthwhile to take a statin. So I can just give you a couple of conditions that are obvious. If your bad cholesterol, or LDL, is over 190, you should be on a statin.
Okay.
If you have diabetes, you should be on a statin. And then after that, what we do is we use a risk calculator. The American Heart Association has a risk calculator that's available online, and you can see your own risk from things like your blood pressure, your age, your sex, whether or not you smoked. And if your risk over the course of about 10 years is more than 7.5% to have a heart attack or stroke in that time, I'd probably take a statin to reduce my risk, almost independent of what my cholesterol is.
Okay, independent of that.
That's right.
What about some people who think, hey, I want to keep eating my lamb chops and cheeseburgers. Instead of cutting them out, I'll take a statin and eat more.
Yeah, so it's not like it's not an airbag in your car. Okay? If you're trying really hard to crash, you're going to crash.
You're going to crash.
And so I would certainly give that person a statin because I want to do my job. But I think, really your health is a partnership. It's not just me. Right. It's you too.
I knew that was going to be your answer.
I know you did.
We'll take a break on that. When we come back, we can open up the phone lines. Are you someone who's had bypass surgery, dealing with a high cholesterol level? I have a question just about your heart health. This guy's an expert. He knows his stuff. Need I remind you that Josh here, he said I could call him that, but it's Dr. Joshua Beckman. He's director of vascular medicine at Vanderbilt, one of the finer institutions in the entire country, if not the world. And he's here for an hour to take your questions or comments. Let's remind folks, heart disease, the leading cause of death for people of most racial and ethnic groups in the United States across the board. African Americans, Hispanics, whites, and it's one of the most preventable. We'll be back with your calls and more of our conversation with our guest right after this.